So you do a lot of bone grafting. In what cases does somebody even need bone grafting?
Correct. So let's say someone's missing 1 or 2 or 3 teeth, right? So they still have a relatively full set of healthy teeth. So we don't want to wipe out the existing teeth, but now that they've been missing teeth in that area for so long, the bone has shrank.
Okay.
Right? It's atrophied and shrank back. Now we don't have enough bone. It's very common for them to go to another specialist or a general dentist and say, we'd like to offer you implants, but we can't because you don't have enough bone. Well, that's not true. There's options on reconstructing that bone or adding more bone.
And this is what oral surgeons do, right?
That's
this
correct.
is your space.
That's correct. There's no one more highly trained or more skilled at doing bone grafting than oral surgeons. So what we do is we actually reconstruct the bone in that area, let it heal, and then we're able to place dental implants.
So is it, are you taking bone from their body? Is it like a bone kit? Is it cadaver? Is it synthetic?
Yeah,
What is it? And do you shoot it in there? How does it work?
There's multiple different types of bone grafting. The first one could be your own bone. We could take it from a different spot. The only issues with that is sometimes you have a second site for a surgery and a little more soreness, but that's definitely an option. The next option would be there's synthetic bone grafts out there. Another option is cow bone or bovine bone. Now, and then the last option is cadaveric bone. Now, when I say bone grafting, I use that term loosely because you think of, oh, cow bone or cadaveric bone. It's not true bone because it's not a living tissue.
Okay.
So they process it. Basically, all that's left is a calcium phosphate matrix. So really, we should call it a calcium graft, right?
Okay.
But by doing this type of grafting, and you have the scaffolding or the framework for your body to
So the
incorporate
bone helps the teeth stay in place.
Correct.
Is that right?
Correct.
Okay. So you need the bone for the tooth to be solid.
Right, you need the bone
Or
for
the
the tooth
implant
to be solid, and you need the bone for the implant to be solid. You cannot place an implant just in gum tissue, right? Gum tissue is soft and it's no.
But this is not a painful procedure either?
No.
I mean, in the hands of an oral surgeon, this is routine.
It's correct. Routine, done every single day. Every single day. And it's minimally invasive because of the new techniques that we have. We don't have to make large incisions. We're able to add bone only in specific places that the patient needs them. And because we don't always have to harvest bone from the patient, we have other options. We don't have a second site surgery where we're causing more pain and more incisions.
For these patients, what's the downtime like? I mean,
Downtime, there is no downtime. They can go back to work, usually that day, or you can go back to work the next day. You have to take an antibiotic afterwards to help with the healing, and that's it. Usually ibuprofen at the most.